Hi, my name is Brian Betz. I'm a doctorate in athletic training student, a part of the 2018 cohort at Indiana State University. I'm a licensed athletic trainer and a certified strength and conditioning specialist. I'm also currently a grad assistant at West Vigo High School in Terre Haute, Indiana. And today I'm going to be talking about meniscus tears and how we manage them. If you don't already know, athletic trainers are healthcare providers working with active populations. Traditionally, they work with athletes in high school, college, and professional settings, but some other settings are emerging as well. Athletic trainers work with the military, fire departments, police departments, in industrial settings, working on posture. They can work as well in theme parks, working with the characters in costume, in orthopedic clinics, physical therapy offices, and many other settings. They really focus on musculoskeletal injuries and some nervous disorders, and again, like I said, in active populations that perform the various physical activities on a daily schedule. So today I'm going to be talking to you about meniscus tears, and before we get into the injury of meniscus tear, let's learn about the meniscus. So the meniscus is cartilage in the knee, and essentially it helps prevent rubbing between the bones. It has another function, as if you can kind of see in this picture over here, that it creates a lip on top of one of the bones of the lower leg, so that the upper thigh bone doesn't move and slide off of the lower leg bone. It's really there, like I said, to help the surface move better so the bones aren't grinding together and hold it in place. This image here depicts the meniscus, a healthy meniscus in the top left-hand corner, and then 5 different ways that the meniscus can be torn, all of which most commonly are on the inside of the knee, is where the meniscus is most commonly torn. But the important thing to know is that depending on the type of tear that you have, will determine the type of treatment that you need and how long it will take for you to recover. So there are a multitude of risk factors that make someone more likely to suffer from a meniscus tear. Specifically, males are 3 times more likely than females to suffer a meniscus tear. Also, the older you are, specifically individuals over age 60, are more likely to have a meniscus tear than younger individuals. And also, it really depends a lot on how much stress you put on the knee. Will make you more susceptible to meniscus tears. So people who do a lot of manual labor work jobs, so a lot of squatting and kneeling, climbing stairs, or participate in sports with like soccer and rugby, where there's a lot of cutting and changing direction, and the knee takes the brunt of the force, they are more likely to suffer a meniscus tear than other individuals who are maybe more sedentary. In this video, I demonstrate how a meniscus injury occurs. Usually, it's by having your foot planted, and then your body's going to twist on that knee, causing a lot of extra pressure. Meniscus injuries can also be caused not just from twisting, but also overuse. That, like I said, that meniscus is there as a buffer, so there's no bone-on-bone action when you bend your knee. But with that, there is a lot of grinding and rolling on that meniscus that can cause little damage each time that eventually builds up. So if you think of the road, right, when you're driving, you have snow that then freezes, right? Snow causes the water in the road to freeze and then melts. Now there's a little crack, and then as that continues, right, over time, eventually you get a big pothole, which becomes a big problem. So how can you tell if you have a meniscus tear? Well, you're going to have some pain, although it's not always the case. If you do have some damage, you might not have any pain. There can be stiffness and swelling in your knee. You might have a sensation of your knee giving way, or you're not able to move your knee through its full motion. Most common key things with a meniscus tear is this catching or locking. It's very, very critical and is most commonly associated with the meniscus tear. So that's kind of the key standard, but the only way to really tell is to get an MRI to really diagnose. The conservative way to treat a meniscus tear is initially with non-steroidal anti-inflammatories, which simply put is ibuprofen and Tylenol. They will help get down the swelling. You can also try and manage meniscus tears with some rehabilitation, focusing on range of motion, so getting that joint to move to its full potential, and also strengthening the muscles around the joint. So the reason why surgery might be needed is, if you look closely here, is a great example of a cross-section of the knee. So if you cut the meniscus in half, here's the lip that holds the knee in, and this red area, the red zone as depicted in the picture, has a pretty good blood supply. And that blood supply allows for proper healing to take place. But as you get closer to the middle, you get less and less blood supply, and it takes more time for the injury to heal. Especially down here in this white zone, there's no blood supply, and therefore any damage to the meniscus won't tear without surgery. This image shows very well the two types of surgery that can take place for the meniscus. So on the left here, we have a partial meniscectomy. That's when you have a little break in the meniscus, usually on the inside edge, and what happens is the surgeon will go in and just clear everything out, take out all the scrap of the meniscus that's left, and leave whatever is undamaged. The other option is called meniscus repair, and it's just like it sounds. They go back in, the surgeon, and they will sew any tears back together. So this is a great example where you have the tear here, and the surgeon goes ahead and puts a few stitches in and repairs the tissue and closes it back the way it was prior to the injury. Depending on what kind of surgery you qualify for and you receive, the time frame that it takes for you to get better will be different. Now, meniscectomies and meniscus repairs are very commonly performed by surgeons all across the world. So the outcomes are usually very good if you adhere and stick to the plan that they give you. Now, meniscectomy will usually take 3 to 4 weeks to heal once you have the surgery. And then a meniscus repair will usually take 3 months. With the repair, you're in a brace and on crutches for about a month to allow the tissue to heal itself fully, so when you put the stress of walking into the equation, the tissue doesn't fall apart. With the meniscectomy, it's usually only about a week or so in the brace because there's no tissue to heal. It's all gone. Just kind of the edges have to heal themselves up a little bit and scar over. But that scarring is normal. With a meniscus repair and a meniscectomy, there's rehab afterwards. So in both of which consist of getting your motion back, so making sure that knee can go through the full motion that it's supposed to, and also building strength, because after you've been in a cast for a while, the muscles around the knee don't move, and when they're not moving, they get weaker. So we need to rebuild up the strength of those muscles. And again, for meniscus repair, it's about 3 months. For a meniscectomy, it's about 3 to 4 weeks. That's total for each. And then also it's important to keep in mind that on average it takes about 3 months from the time of injury to get an appointment for surgery. So between that date of surgery and the time of injury is about 3 months. Could be more, could be less, but that's about average across the United States. These procedures are so commonly performed that, like I said earlier, when you get one of these surgeries, it's very unlikely that you're going to have complications by the end, although there's a small chance that that may happen.